Hello, we are team number 1, and we are about inner peace. My name is Alan Andrade. I'm an attending physician here in the Department of Geriatrics and Palliative Medicine. My job includes helping seriously ill hospitalized patients, many of whom suffer with pain and fatigue as a consequence of their illness. And we approach these patients in a team, and part of our team includes massage and mindfulness-based experts who deliver mindful-based meditation to these patients. And I've seen firsthand the benefit that these patients have received, including reductions in pain, reductions in need for medications, reductions in the need of side effects of these medications, and length of stay in the hospital. The issue I have is that my therapists are finite, and they only have a finite amount of time to spend with the patients, and we have a lot of patients. So we wanted to explore solutions that could help our therapists engage more the patients who are in the hospital to practice these mindfulness-based interventions. So we propose an application that we can prescribe to patients while they're in the hospital. The patients would log in, answer a few questions about their state of well-being and how they're coping in their hospitalization and with their illness, and really personalize and tailor our intervention to these patients based on what they've entered into the system, and display it in a way that uses game thinking and game mechanics to really engage the patients and motivate them to use this. And we already have the content developed. Our center here has developed a lot of content for these patients. We are a nationally recognized center for integrative health, and essentially what we would like to do is streamline how that content is delivered. The areas that we specifically like to target include talking about death, talking about how to talk to a loved one about death anxiety. The types of interventions that we will deliver include mindfulness, legacy work, and improving emotional resilience. The product will have content that also provides material that physicians can bill for, such as advanced care planning, and have a number of productivity features that would really augment the power of this app, such as scheduling events, push notifications, and capturing audio and video for legacy work. And we plan to integrate with Salesforce Chatter and deploy this to the Sinai AppLab's treatment universe to all our patients. Specifically, the outcomes that we're looking at is health-related quality of life in hospitalized serious ill patients, looking at their length of stays, looking at nurses' pain assessments, monitoring the need for opioid and anxiolytic antidepressant medications, looking to see if side effects are reduced because of less use of medications, and monitoring patient satisfaction scores. Currently in the United States, 85% of hospitals currently have a palliative care service. We have a fertile ground to expand this if this is successful here. And this is a low-cost, content-rich environment. There are currently 1.5 million hospice patients, and hospice patients are patients the last 6 months of life. Palliative care encompasses a lot more patients, essentially patients who have chronic illness, who are ill, and they have a lot of needs. Our business model includes monthly subscription to host content, to licensing opportunities, partnerships, and billings for advanced care planning. Our team is made up of computer designers, computer programmers, mindfulness experts who are recognized in this area, and clinical trial experts. Thank you.
Can you review your outcome measures for your intervention?
Sure.
You listed them quickly. You have patient satisfaction. What kind of RN? So the patient. Oh. Can you go over your outcome measures more?
Yes. The primary outcome measure is health-related quality of life. We are also monitoring length of stay, assuming symptoms improvement would allow patients to go home sooner. We are monitoring the outcomes of the nurses' pain assessments of these patients as they do these mindfulness things throughout the hospitalization. We're monitoring the need for standing opioid use during the hospitalization stay, with the hopes that less opioid use will lead to less side effects experienced by the patients. And essentially, this is a patient engagement application. We're hoping that by providing this material that we improve patient satisfaction scores.
I was just confused. So in the beginning, would there be a therapist going over how to do all these mindful-based stuff each day with the person?
Correct. We have a service where our therapists provide and will help onboard the patients and help prescribe what they need to do and guide them through if they're struggling. And that's why I want to try to provide this in the hospital. The issue is the therapists only have a finite amount of time, and this is to engage them throughout their stay.
So then will there be a time period when they don't have the therapist in the hospital, and so they'll have to do it on their own?
That's the idea, that if they enjoy the application and they want to continue to use it outside the hospital, they've had the opportunity to try it in the hospital, ask questions to the therapist, and then continue to use it after.
So have you done any research on other apps that people have tried to use in terms of adherence to other sort of diseases and that such?
There are a number of applications out there that target different areas. Most of the applications are very generic. There are very few that specifically target seriously ill hospitalized patients. Most of the studies are very small. All of them say everyone likes it. But as far as hard outcomes, I haven't seen any robust evidence. What I have seen is that some mindfulness in a controlled trial, mindfulness interventions sometimes are as powerful as actual medications.
How did you justify mindfulness versus hypnosis or relaxation or in the intervention?
Well, they all have similar concepts. Essentially, what ends up happening is the person goes into a trance-like state where they are focused on something other than their pain. And that's just distilling it down to its bare bones.
That's good.
And I think, just to close the loop, I think there's a need for that. One thing probably I'll recommend is to add peer or caregivers into it, because that's you'll be shuttling back in homes and other stuff, and that's a need. And just for the judges here, the concept is there. Have you executed in terms of building something, or that's the next stage which you are hoping to go for?
That's the next. This session has really helped me build a team, has helped me develop the concept, because this was a new venture for me. And we have something exciting in our team, and we have a clear path forward. So we're hoping with your support and shedding some light on this, we have a great opportunity to do something good here.
Awesome. Thanks very much. Thank you, Alan.